Oliver wasn't depressed. He loved life and life loved him. He was incredibly popular.
Paralympian hopeful Oliver McGowan was just 18 years old when he died after suffering from a reaction to an antipsychotic drug, a death his mum, Paula McGowan, believes could have been preventable. Oliver pleaded with doctors and nurses not to be prescribed any antipsychotic drugs, but because of his autism, his mum believes his wishes were ignored.
And we made it clear what Oliver's wishes were, and we told her what our wishes were, and she absolutely did not have ours or Oliver's permission to administer any antipsychotic medications.
Sadly, Oliver reacted so badly to the drug that his body reached a temperature of 43 degrees.
We were told his brain was so badly damaged that he would be left with no speech, no memory, he would be blind, he would be reliant on breathing tubes, tube fed. They told us he would just be a body laying there.
Since his death, Mrs. McGowan has launched a petition campaigning for mandatory autism and learning disability training for doctors and nurses. She told Kent Current that she believes had the healthcare professionals had this training, her son's discomfort in the hospital and even his death could have been avoided.
So talk to the person like a normal human being. Don't talk in medical jargon. Don't stand over your patient if your patient sat down. Don't stand in the face, give them space.
Although the inquest ruled against Oliver's mother, saying it was appropriate for the teenager to be given the antipsychotic drug, the petition for staff training reached over 50,000 signatures and was debated in Parliament earlier this week.
We didn't have anybody oppose the debate, and everybody was in agreement. It really was. You know, it was powerful, it was emotional, but they spoke about Oliver's story, but they spoke about him with such empathy and respect.
Sarah Maguire, Chief Executive of Choice Support, a charity for autism patients and their family, said everyone has the right to the same level of healthcare, regardless of their disability.
People with learning disabilities and autism, have the right to have good healthcare like everybody else. Time and effort is put into that. It should be put into understanding people with learning disabilities and autism.
Mrs. McGowan continues to raise awareness of preventable deaths in patients with learning disabilities and hopes that her tireless campaigning will save lives in years to come.